Hi friends, today we can talk about breastfeeding. Most of us know that there are many benefits to breastfeeding, and the benefits are for the child. The breast milk is the best source of nutrition. It is completely based on the nutritional needs of the child. It also has a lot of antibodies which help protect the baby from infections like gastrointestinal and respiratory infections. It also helps to keep the baby's weight in balance so that the baby is not too obese or not undernourished or underweight. It also has benefits for the mother. It is protective against cancer. It helps the uterus to shrink or reduce in size and contract, which also helps to reduce any bleeding that can happen after delivery. It is also important to remember that breastfeeding should be initiated within half an hour of the baby being born, and it up to 6 months the baby can have exclusive breastfeeding. So the baby doesn't need anything in addition. It doesn't need water, it doesn't need sugar syrup, it doesn't need gripe water or anything else. And also after 6 months, breastfeeding can be continued as long as the baby would like to feed, and as long as the mother is comfortable. But after 6 months, the baby has to be initiated on other foods, or what we call the weaning foods. Also, within the first 3 or 4 days, the milk doesn't look like milk. It looks watery and it looks yellowish, and this is called the colostrum. And many people discard the colostrum. This actually is very rich in nutrients and also antibodies, so it has to be given to the child. And unfortunately, in India, we have almost 60% of women going in for cesarean sections when the actual expected rate is around 15%. So a cesarean section can make it uncomfortable for the mother to feed and also delay the initiation of breastfeeding. So therefore, it is important that only as many cesarean sections as required are conducted. Also, there are some women who may not be able to feed because of mental health issues, or because she's separated from the baby, or she has other health issues. So it is important to support even those women rather than being judgmental. And the way the baby is positioned is important. So basically, the head of the baby and the body should be aligned in one straight line. So if the baby's face is turned, then the baby will not able to swallow, and also this reflex of suckling gets affected. So the baby should be facing the mother, and the mother should be in a comfortable position, and only the nipple should not be in the baby's mouth, because that causes a lot of pain and irritation to the mother. It might lead to discontinuation of breastfeeding. It is important that the baby's mouth is around the dark skin around the nipple, which we call the areola. So that is where most of the stimulation happens for milk to be released. And also, many of us, we turn the baby like this towards the breast. So the automatic reflex of the baby is to turn towards wherever it is touched, and that is called the rooting reflex. So ideally, you should stimulate the angle of the baby's mouth with the nipple, and the baby automatically turns towards the mother, and then opens its mouth automatically, and then you make sure the nipple and areola are inside. And if it's done properly, then the mother will not feel any pain. This is supposed to be described in the hospitals itself, and the mothers, especially the new mothers or very young mothers, need support, even though breastfeeding is a natural process. And the milk that comes first is what we call the foam milk, and that is a little more watery, and that helps the baby to quench its thirst. But if you keep shifting the breast from the left to right and only give the baby the fore milk, then the baby will not get enough nutrients, and it'll start feeling hungry faster. It'll need to feed more frequently. So ideally, if you feed from one breast, you should make sure that you give the initial milk and also what we call the hind milk. That is a milk which comes later, and then at the next feed we can shift to the other breast. And a lot of women are told that the breasts are small and therefore they may not have enough milk. So the breasts are not like milk containers that you store milk, ready-made milk. The breast produce milk as and when the baby suckles. So how you measure whether a baby is feeding adequately is by seeing the urine output. There should be at least urine output once in 2 hours. The urine should not look concentrated and yellow, but should be light colored, which shows that the baby is not dehydrated. And also we have the TAI cards, or we have the growth charts, which look at whether the child is growing adequately. And if the child is growing adequately, and if the urine output is good, the baby is happy, the baby is sleeping well, not constantly crying and irritable, then you know that the baby is receiving adequate breast milk. And it is important to support the mother with good nutrition and not follow unnecessary taboos restricting her diet based on taboos. Make sure she's mentally supported, and also avoid too many relatives in the initial few weeks, especially handling the baby, too many people handling the baby. Give time to the mother while also supporting her. Yeah, that's it. Thank you.